I had a previous career as an engineer, and decided that after graduation that maybe that's just not the right path for me. It was my mom that influenced me. We had a conversation about, hey, what other career paths, I can choose. And at the time she said, you know what, you have a very strong background already with your engineering degree. And also too, she goes, you really have some very good people skills. So what about pharmacy? Because she had learned that at the time my cousin had graduated from pharmacy school and she was really enjoying her career out in California. And so after a couple of inquiries, talking to my cousin, I thought, you know what, this might be a really good move for me. And so at that point, I went to the School of Pharmacy and spoke to a couple of advisors there who also thought that this may be a very good fit for me. So, that's kind of how I arrived. A typical day for me would certainly involve dispensing, the dispensing portion of it, as well as going through and making sure that medications are safe, effective, for the residents, that we serve. The other hats that I also wear in the pharmacy itself is additional services. We do things like, for example, immunizations comes to mind right away. In fact, we're really one of the point pharmacies during the COVID pandemic, as well as the annual flu shots and any other shots and everything that we give right now. So that's one of our other roles. We also work with patients to work on, we do a lot of adherence counseling. We also do comprehensive medication reviews with our patients too, just to make sure that everything is on the same page and they continue to experience the best benefit they can with the medication therapy that they're provided. The second hat that I wear is also to make sure that I develop future generations of pharmacists. I also serve as a clinical instructor with the University of Wisconsin School of Pharmacy, so I get to develop students as they come through, as well as serve as a preceptor right now for our residents, that come through also. So I find that to be very rewarding because I know that I'm giving back, to the pharmacy profession by, developing and inspiring and mentoring future pharmacists. So the most rewarding, I think, as a pharmacist is the impact, that we have upon the residents of Reedsburg that we serve. It's the impact that we make. And what I mean by impact is not just talking about their medications, but developing relationships, right? Developing rapport and developing lasting relationships, because the stronger the relationship, the better we can serve our patients. They feel more open, they feel like they're talking with a member of the family, a trusted member of the family with expertise in medication. So they don't have to feel timid. They can approach us and say, hey, Charlie, I've got a question about my medication. So that's what I find very rewarding, in that sense that we are the access point, we are a resource that we serve for our patients with regards to our medications. The second, of course, rewarding is what I spoke of earlier, and that's really ensuring that future generations of pharmacists gets to see, a model of what good practice is. And that's something that I know that the pharmacists at the Reedsburg Area Medical Center do. They practice good pharmacy. They're really, really good mentors. They're really great role models. And so I think it really excites me when I see students or residents that walk away and with just really a glowing recommendation, and later on even wanting to come back and work as residents for us, or even be hired as pharmacists for the Reedsburg Area Medical Center. I have an extremely lovely wife and wonderful mother, and I'm the proud father of 3 young men, so that is my second full-time job away from my job here at the Reedsburg Area Medical Center. Family time is very, very important to me as they continue to grow and develop. But what I enjoy is activities, with my kids. My oldest really enjoys playing baseball. So that's something and everything that we can do as a father-son. My second son really enjoys playing piano, and he's pretty darn good at it too. And so I just enjoy listening to him play, even though I don't have much of a musical background. And my youngest gets into Lego. So guess what? I fuel one of my little hidden passions right there, which is having fun, constructing things with him, and watching him develop in that way. So other than that, I really enjoy being in the outdoors. I enjoy walking, I enjoy hiking. The other thing too is I enjoy grilling out for the family. So it's some of those things, that the Reedsburg Area Medical Center is allowing me to do, because I get that extra family time, which really just absolutely jazzes me.